set them up in 2015, and they were going well. And the income was going up. The patients were coming in, both from the NHS and the private patients. But the owner, the main funder, basically was impatient with the rise in patient numbers and decided he didn't want to continue. And the banks basically pulled the plug. And so I was the medical director. So I was responsible for the governance and the medical care of patients, not the finance. But it was clear that we were getting stuck. And although there was various ways of trying to bail the whole thing out, in the end, it didn't happen, and it closed suddenly in June of last year, 2022. And that meant that they closed the one in Newport, which was a beautiful centre just off the M4 in Newport, closed down, leaving a lot of equipment completely there, and it's still there now, sort of 16 months later, just empty.
And you wrote to the Health Secretary, the Chief Executive of the NHS Wales, and the Chief Operating Officer of the site owner Equitix. Did you receive a response?
Absolutely nothing. The only thing, Wales Online did a little piece 2 days ago, and the chief operating officer of Equitix, which is the company that actually owns it now, they were the main debtor of the company, was quoted in that. But I've had absolutely no communication with anybody. And the tragedy is the centres are there, the 4 centres. One has actually been sold to the NHS, but the 3 in Liverpool, but the 3, including the one in Wales, in Newport, is just standing there empty. And there's no plan for it to move on.
And why do you think this industry-leading equipment hasn't been moved from the Rutherford centres to current NHS hospitals?
Moving equipment's actually quite difficult, especially complex radiotherapy equipment and proton therapy equipment. But it could be used there. I mean, Newport has no main cancer services. It's all done in Cardiff at Velindre Hospital, which itself is being rebuilt. It's being restructured. It hasn't got the capacity to treat the people of South Wales. And there's 2 centres in South Wales, one in Swansea, one in Velindre at Cardiff. But it needs more. And Newport's a big city. I mean, it's really quite a big town. A lot of patients down there. And obviously it drains from the valleys down into Newport. So it would make such sense for the NHS to take that over. But, the politics of healthcare are very complicated, Jack.
And what can be done, or what can we do as the general public to encourage Equitix to move forward with bringing these cancer centres back to us?
I think the most important thing is to get them open again. It doesn't matter how. They were built in the private sector, but with the NHS in mind, and the NHS has used them in Newport and all the way across the South Wales coast, right the way to West Wales. So I think it's really important to try and get them open again. And, the politicians have been very slow at trying to do something. And part of the problem is in Britain, as compared to the rest of Europe, is there's the public sector, the NHS, and the private sector. But in Europe, it's mixed. The private providers provide essentially NHS services, and that's what I'd like to see here. And I think it's very sad in Wales, because as Velindre gets redeveloped, it's really going to be difficult. There's going to be constriction on capacity in Cardiff. So having something like the centre in Newport open would make it a lot easier to rebuild Velindre.
And do you have any next steps? What are you going to do now in terms of trying to get these centres back open? What do you think the long haul will be?
The main point is Equitix, which is basically an infrastructure fund that are not used to healthcare. And this for them is small beer. They made the 4th lane on the M25. They've paid for it on the government loan and so on. So what we need to do is to get Equitix to understand that this is healthcare, this is important. Huge backlog in cancer all around the country, not just in Wales, but everywhere. And it's nobody's fault, it's COVID, it's there. So can we get Equitix to agree to let the facilities be used by the public sector now and then bring them back partially into the private sector later on? That would be my solution to it.
We have asked Luned Morgan, the Minister for Health and Social Services of Wales, for their response to the Professor's comments.